My grandmother was buried before she was born. Not metaphorically, literally. She came into this world uncold, wrapped inside an intact amniotic sac. A rare event that happens 1 in 80,000 births. My great-grandmother, she had already had 9 children. And when she saw this strange, silent, translucent thing come out of her, she panicked. And she asked the older children to bury it in the garden. But when the children saw this sack move, they ripped it open. And my grandmother took her first breath. This was 1932. She is 94 years old today. She came into this world fighting for her life, and in many ways, she never stopped. Because the world she was born into was not the world designed for women. My great-grandmother ended up having a total of 11 children. Not because she chose to, but because she had no real choice. She had been forced into marriage at a very young age. And at the time, the Portuguese constitution stated that all citizens were equal apart from the woman. Financial abuse was institutionalized. A husband could legally forbid a wife from working, starting a business, making decisions about her own life. My grandmother, she always dreamed about being a nurse midwife. But my grandfather simply said no. And legally, that was enough. My mom was their second child, and it was when my mom was 10 years old that women in Portugal gained the right to vote, but with limitations. Only literate women could vote, and many had not been given the opportunity to learn. It was when my mom was 18 that women in Portugal gained full legal equality. Just one generation before mine, women were still being told, legally, structurally, and culturally, you cannot, you should not, you must not. And here is what I have learned from studying 4 generations of women in my family. Inequality is inherited. Just like eye color or height, it shapes the risks we take, the dreams we allow ourselves to have, the ones we silently delete. And even today, when a woman makes a decision in life, in business, relationship, health, or money, she isn't just navigating her own beliefs, she is navigating decades of coded expectations. A code written by others. A code that urgently needs reprogramming. And if this is how society has treated women's rights, just imagine how it treated women's health. Did you know that for years, researchers have used mostly male mice? Female mice were thought to be too complex because of their hormonal cycles. The results? Medicines approved for both sexes, only to later discover that females' bodies respond differently. Take zolpidem, for example, a common sleeping tablet. Research initially focused on men, and later they discovered that women's bodies metabolize the drug more slowly, resulting in higher amounts of the medicine still in the bloodstream in the morning and higher chances of side effects. Another example, endometriosis, which affects 1 in 10 women. Yet, diagnosis takes anything between 7 to 10 years, because symptoms like severe pain is considered normal or exaggerated. And for context, there has been 5 times more research on erectile dysfunction than premenstrual syndrome, when erectile dysfunction affects around 20% of men, and premenstrual syndrome 90% of women. For too long, medicine has been like building a map using only half of the population, treating women as smaller men. But today we stand at a crossroads, because medicine is being rewritten, not in textbooks, but in code. Artificial intelligence is rapidly becoming the brains behind medical decisions. What gets diagnosed, what gets treated, what gets funded, what gets prioritized. But here is the risk. If we feed AI the same biased data sets of the past, we won't just repeat inequality. We will automate it at speed and at scale. But here is the opportunity. If we correct the data, if we include women fully, if we demand equity by design, AI can become the greatest equaliser healthcare has ever seen. So the question is not whether medicine will change, the question is, who will it be built for? And this is the moment it shifts. Imagine if endometriosis could be flagged in days instead of years, because AI detected those subtle patterns in symptoms that doctors often miss. Or if new treatments for fertility or cancer or cardiac problems could be tested first in digital simulations of female bodies before reaching real patients. And just imagine if when a doctor makes a decision, they could be certain that the data they are using actually includes people like you. This is not science fiction. This is a future that we can build. A lot has happened in the last 100 years. And unlike my grandmother, I was able to study, become a nurse, and work inside the healthcare system itself. And my work is shaped by a simple belief that health shouldn't depend on luck or time or whether a doctor believes your pain. And that's because before I was a nurse, I was actually a patient. Before I saw the system, I survived it. I know what it feels like to carry symptoms for years, to repeat tests, to sit in waiting rooms for hours on end, and to be told everything looks normal, when nothing feels normal. My personal frustration became my professional purpose, because once I saw the system from both sides, so many women's stories like mine, I realized the problem is not lack of knowledge or competence. The problem is lost information. And this is where AI can become the great equalizer, not by replacing clinicians, but by making sure that no patient information gets lost in the system. In my work, we are already using AI on a daily basis, connecting fragmented systems, and it works as a second pair of eyes to spot any missing or outdated information, to detect those patterns and suggest a diagnosis, to support clinicians with evidence-based next steps. But If we want AI to become this great equalizer, we need more than just good technology. We need values built into the code. So every data set that we build, we ask, who is missing? Not just the easy patients or the average ones. Women of all ages, ethnicities, body types, and life stages, everyone deserves to be visible. And every model that we test, we ask, who does it fail? We shine light on bias before harm happens. And every recommendation we make, we ask, could a human explain this? AI suggests, doctors decide, a patient understands. If we build AI with these principles, it will become what it was always meant to be. Not just smarter healthcare, but fairer healthcare. Healthcare that is more inclusive, more transparent. Healthcare that is more human. When I look back on that moment of my grandmother being carried uncalled to be buried in the garden, I think how easily her life could have ended before it began. And I wonder how many women's lives have we buried? How many symptoms dismissed? How many diseases untreated? Because for years we have been burying women's health under layers of bias, neglect, and outdated systems. But today, as we stand at this new moment in history, and we have no doubt that AI will change the future of healthcare, the only question that remains is, will it break it or fix it?